Thank you very much. It's a very great honor for me to be standing here and addressing this Congress, and I have thoroughly enjoyed the previous 3 days. Thank you very much indeed. And I'm grateful to my distinguished speakers for setting the scene so beautifully. I want to talk about the kind of medical leadership that does not work in addressing these wicked problems. And I want to talk about the kind of leadership that does work and why. And this comes from 20 years of trying to change the world, of being bloody-minded, determined, willing to endure endless failures and mistakes, to sell my house, to quit my job, to be unbelievably committed in an attempt to change the world, and through those mistakes and failures to learn something about what does work. 13 years ago, it became very personal. My 18-year-old daughter, Chloe, crashed a car and was rushed to hospital. She broke her neck and her back, and as a consequence spent 100 days and nights in a hospital flat on her back in spinal traction. I'm happy to say that her clinical care was excellent, and she made a full recovery from her injury, and she walked unaided out of the hospital a week after the traction was taken down. What distressed me was the total lack of meeting her human needs in those 100 days. Imagine lying in bed, completely immobilized in spinal traction, and this is your only view of the world, the ceiling of a hospital room. She could not see a television or read a book or a magazine or see out the window or see the faces of the people who came in the room, nor reach the food tray that was left out of sight and out of reach and then taken away again, and she was starving in a hospital. And the lack of attention to her basic human needs was just utterly callous. And at the time, I was in a powerful leadership role in healthcare. I had a personal relationship with the New Zealand Minister of Health. None of that was of any use at all in trying to get the hospital to respond to basic human concerns. So for 13 years, I've been campaigning around the world, and I want to share some of my lessons. 5 years ago, we sold a house and quit my job, and my wife and I founded Hearts in Healthcare. I've learned in all that time that our materialistic science is profoundly misleading, that each of our patients is an amazingly dynamic mind-body whole. For instance, a 9-week program in mind-body medicine changes the expression of more than 1,000 genes in patients with inflammatory bowel disease. I've learned that the quality of compassionate caring makes an equal difference to the outcome of our patients as the treatments we administer. Here's some evidence. Diabetic patients who belong to physicians who are empathetic have 42% fewer admissions to hospital for diabetic ketoacidosis. Patients with terminal lung cancer, a randomized controlled trial, those who had access to palliative whole person care, compassionate care, had much higher quality of life, less depression. They made very different decisions about care. They turned down a lot of the chemotherapy and radiotherapy. No thanks, doc, I don't have time for the chemo. I'm off to Australia to see my grandson. They were trading off quality of life for survival time. The total cost of care fell because they turned down a lot of interventions. Actually, these patients that turned down the medical interventions had a 30 to 40% increased survival time. This is whole person compassionate care. This is a randomized controlled trial of compassionate care in an emergency department, a hospital in Canada, a series of 127 homeless men. Those who received the compassionate care intervention had a 30% less incidence of representation with the same condition in the period of the study. What was the compassionate care intervention? A volunteer sat and talked to the patient for half an hour. That's it. It begs the question, what is missing from usual medical care? This is perhaps my favorite trial. It's a randomized controlled trial of anesthetist being nice or not so nice in the pre-op consultation. What this trial showed is that if anesthetists, or in this case anesthesiologists, were supportive, empathetic, compassionate for the 5 minutes of the pre-op consultation, that the patient's requirement for morphine after major surgery was halved, and the length of stay was substantially reduced. This is an old study, but very well designed. A recent study, almost identical, shows improvements in surgical wound healing and improvements in surgical outcomes. Even in trauma, where you think it's the technical skills of the surgeon that determines outcomes, this study shows that those patients who rated their trauma surgeons as having high empathy are 20 times more likely to have better functional outcomes 6 weeks after discharge. Helen Rees heads up a group at Harvard, and they're the world authorities on the role of empathy and compassion in healthcare. They've done a meta-analysis of the 13 best randomized controlled trials, and they've concluded the effect size is important, that the physician-patient relationship has a bigger effect size on 5-year male mortality than smoking cessation or taking an aspirin, and probably more than taking a lipid for primary prevention. We also know that when care is patient-centered, there is a dramatic reduction in downstream tests, interventions, and specialist referrals. And a very large study in the USA where they can measure the total costs of healthcare with extraordinary detail shows that those patients who flow below the median in patient-centered care and primary care, their total cost of healthcare in their whole system is increased 50%. This is one of the most powerful determinants of healthcare expenditure we've ever discovered. So relationships matter. So this is a win-win-win for the patients, for the health professionals who come back into joyous practice and are protected from burnout, and for the healthcare managers and funders, because this reduces demand and reduces cost. So why doesn't it spread like wildfire? And in 13 years of campaigning, I've had a great deal of difficulty spreading this message and getting anyone to pay attention, but I've become much more successful in the last 2 to 3 years, and I want to share why. I think it's the way we think about the world. Medical science has become very objective and rational and materialistic. We're much more body mechanics than healers. We have lots of evidence-based practice for disease management. There is almost no evidence-based practice about how to care for a whole human being. So if this materialistic rationalist approach is not helping us in solving wicked problems like obesity, what is going to be more productive? I want to share with you the 5 biggest mistakes I made in a whole decade. I started my work really angry. I was a moral crusader. I was very angry at doctors who are callous and managers who are uncaring. I became an evangelist trying to persuade people. I had a weight of science and research and evidence. I became a content expert, but I can tell you that trying to teach doctors and nurses how to be compassionate is a really good way to put their backs up. We wanted our work to be sustainable, so we created a business, and I charged fees for consulting work and speaking and selling books. And largely we focused on problems, and all of those 5 strategies, which are very familiar to all of us trying to tackle any problem in the world, all of those were counterproductive, and they made us ineffective in our work. And the 5 ways that worked better was to let go of judgment and to show compassion, to have compassion for doctors, for managers, to not to try to persuade anymore, to give up the need to be right, to be vulnerable. Instead of being the expert, to pull out and uncover the wisdom in the group, and we've just heard a wonderful example of that. We moved our work into the gift economy, so I no longer charge a fee for speaking. I don't charge any money for consulting work. My latest book I've given away completely for free. We invite people to make a donation in support of our work. We're not a charity. We're making more income in the gift economy than we were in a business transactional model. And we never focus on problems. We use appreciative inquiry to draw out stories of works best. This is a slide from a TEDx talk I did last year, and it wasn't until I made the slide that I recognized an extraordinary pattern, and that is that all of the strategies that didn't work involve fighting and separation and scarcity. And all of the strategies that did work involve interconnection and abundance and healing and compassion. And this gives us a clue as to what are the drivers of the social determinants and how we might tackle them more effectively. So if we think about the wicked problem of obesity, many of you will be familiar with the spirit level. This shows that the rates of obesity are dramatically different in different countries, and they correlate extremely highly with income inequality. Not the wealth of a nation, but the level of inequality. So what is an obesogenic culture? Maybe it's more than fast food and sugary drinks. So there are 2 myths in the world. The myth is the set of stories, assumptions, unconscious beliefs that tell us the story of what we believe about how the world exists and how it works and how we should be effective in trying to change the world. And in our Western society, going back at least to the age of the Enlightenment, we have a myth of separation. We have a belief that rationalism will help solve our problems. We have a clockwork universe. We have clockwork machine-like patience, that only the material world is real. We discard spiritualism and even consciousness to a separate realm, so we throw away the placebo effect. Our society is dominated by individualism and competition. Man's role is to dominate nature and to conquer disease. And we have an extraordinary set of beliefs and ideas about the idea of ownership. What that means is that every single human gift, like a story or an idea, has to be copyrighted and owned, controlled, and sold as a commodity. Every gift of nature has to be turned into a commodity to be controlled and owned and sold. And our economic system needs everything to have a price, and the only way to create a price is to create scarcity, because if something is universally available, it has zero price, zero value. So our economic system creates scarcity. And I think this is the obesogenic culture, this set of unconscious beliefs and assumptions about the world. And I think these are the key drivers of inequality, of poverty, of violence, of consumerism, of our environmental degradation and climate change, and the major drivers of chronic disease. And there is a competing myth of the world, which is the story of profound interconnection, of a universe that's alive with meaning, where we're profoundly connected and interdependent, where one small act of compassion might change the world as powerfully as the biggest campaign, where man and nature are profoundly interdependent. And instead of ideas about ownership, there are ideas about stewardship and guardianship of the commons for the benefit of all. And these are the ideas, the myth of the world, we typically see in indigenous cultures. And I've found that my work can flourish in this myth of connection. And this is the world in which compassion, connection, meaning, divine purpose, healing, and well-being. This is the world myth that we need to incorporate in society to tackle our problems of poverty and ill health and the social gradient. So the final question I'm going to leave you with is, what kind of leadership do we need to be truly effective in changing the myth of the world? Are we going to be heroes? Are we going to be fighting the war against cancer, the war against drug, the war against corporations, battling to save the environment? Are we going to be moral crusaders and evangelists? Are we going to be the experts? Are we going to try and use our economic system? Are we going to focus on the problems? Because I believe that every one of those strategies only reinforces the conditions that causes the problems in the first place. And I think we need a different kind of leadership, which is more akin to being a healer, of non-judgment and compassion, of being vulnerable, a willingness to learn, seeking wisdom, stepping out of economic systems to being generous and giving a gift to the world, and a focus on what works best. And I'm going to leave you with this question and this slide as the final slide of the conference.